Breathing is something most of us don't even think about. We inhale and exhale effortlessly. We begin to focus on our breathing when someone draws attention to it, like right now. We also start to concentrate on our breathing when it becomes difficult. We all have dealt with difficulty breathing at some point in our lives. When difficulty breathing is paired with other symptoms such as fever, cough, and phlegm production, this is most commonly due to an infection of the respiratory tract, aka pneumonia. Now imagine this debilitating infection in patients that have exhausted themselves to the point that they are unable to breathe. These patients eventually require assistance to breathe. This is achieved by placing them on a mechanical ventilator. Patients that are mechanically ventilated are at a higher risk of developing a more serious type of pneumonia. Welcome back to Zaco and our 5-part mini course on healthcare-associated infections. In this video, we will dive deep into ventilator-associated pneumonias. Before we talk about ventilators, let's briefly go over the basics. Breathing is a vital component to living. This is done by our respiratory tract. The respiratory tract is responsible for the exchange of gases that sustain life. It consists of 2 main parts, the upper respiratory tract and the lower respiratory tract. The upper respiratory tract includes the nose, nasal cavity, sinuses, and pharynx. This region serves as the first line of defense against airborne pathogens and particles. The nose filters, warms, and humidifies the air we breathe, while the sinuses help reduce the weight of the skull and enhance our voice. Moving down, we enter the lower respiratory tract, which comprises the larynx, trachea, bronchi, and lungs. The larynx, or voice box, plays a crucial role in sound production and protects the airway during swallowing. The trachea, or windpipe, branches into the bronchi, leading to the lungs. Here, the bronchi further divide into smaller bronchioles, culminating in tiny air sacs called alveoli. This is where the magic happens. Oxygen enters the bloodstream, and carbon dioxide is expelled. The alveoli are surrounded by capillaries, allowing for efficient gas exchange. This process is essential for maintaining the body's oxygen levels and removing waste gases. Pneumonia is an infection that inflames the air sacs in one or both lungs. These air sacs may fill with fluid or pus, leading to symptoms such as cough, fever, chills, and difficulty breathing. There are several causes of pneumonia, including bacteria, viruses, and fungi. The most common type is bacterial pneumonia, often caused by Streptococcus pneumonia. Viral pneumonia, on the other hand, can result from infections like the flu or COVID-19. Diagnosis typically involves a physical exam, chest x-rays, and sometimes blood tests or sputum cultures. Early detection is crucial, as pneumonia can lead to serious complications, especially in vulnerable populations such as the elderly and those with weakened immune systems. Patients with pneumonia are usually treated in hospitals with a course of antibiotics, rest, oxygenation, and hydration. However, some patients may not respond to these treatments. In critical care, the ability to provide adequate oxygenation and ventilation is paramount. Mechanical ventilation is a life-saving intervention used in various medical scenarios. But why is it necessary to mechanically ventilate a patient? First and foremost, mechanical ventilation is employed when a patient is unable to breathe effectively on their own. This can occur due to conditions such as severe pneumonia, acute respiratory distress syndrome, or neurological impairments. The primary goal of mechanical ventilation is to ensure that the lungs receive sufficient oxygen while removing carbon dioxide. This is crucial for maintaining the body's metabolic functions and preventing respiratory failure. While life-saving, ventilators can also introduce challenges, including a serious infection called ventilator-associated pneumonia, or VAP. Ventilator-associated pneumonia is an infection that occurs in the lungs of patients who are on mechanical ventilation for more than 48 hours. It is one of the most common hospital-acquired infections and can lead to serious complications. So what causes VAP? The primary culprits are bacteria that enter the lungs through the endotracheal tube. This tube, while necessary for breathing support, can provide a pathway for pathogens to enter the lungs, especially in patients with weakened immune systems. Several factors increase the risk of developing VAP, including prolonged mechanical ventilation, the use of sedatives, and the patient's overall health status. Patients with underlying conditions, such as diabetes or chronic lung disease, are particularly vulnerable. Recognizing the symptoms of VAP is crucial for timely intervention. Common signs include fever, increased respiratory rate, purulent sputum, and changes in oxygenation. If you notice these symptoms in a ventilated patient, it's essential to alert the medical team immediately. Preventing VAP involves several strategies. This is usually done using a care bundle. This care bundle includes a number of vital steps that have been shown to significantly reduce the incidence of VAP. Elevation of the head of the bed 35 to 45 degrees prevents possible aspiration of gastric content. In other words, sitting a bit upright prevents food from the stomach flowing back into your windpipe. This prevents a specific kind of pneumonia known as aspiration pneumonia. Maintaining good oral hygiene. Believe it or not, good oral hygiene must be done even when there is a breathing tube in the patient's mouth. The use of antibacterial mouthwashes in patients on a mechanical ventilator is another crucial element in the VAP care bundle. Patients that are mechanically ventilated are usually sedated. This is done to provide some comfort to the patient in question. It is very uncomfortable having a tube stuck in your mouth for long periods of time, and even more uncomfortable if a machine is breathing for you. So sedatives are quite necessary for these patients. Nevertheless, too much sedation can actually hinder the recovery process. This is why applying a sedation vacation to mechanically ventilated patients is a must in preventing VAPs. Regular suctioning of secretions from the mouth and airway removes fluids that could potentially carry bacteria into the lungs. The use of anti-acid medications and anticoagulants for mechanically ventilated patients ensure that acid reflux and possible thrombi do not irritate the already debilitated patient. Finally, the daily assessment for possible extubation is the last vital element in the VAP care bundle. Daily assessment of the patient's readiness to be weaned from the ventilator is critical. The sooner a patient can breathe on their own, the lower the risk of VAP. No one wants to keep a recovering patient on a mechanical ventilator. So, if the patient is fit for extubation or removal of the breathing tube, it is done as soon as possible to prevent VAP. All of these, in addition to basic infection control practices such as good hand hygiene, use of PPEs, standard and transmission-based precautions, aseptic techniques, and overall cleanliness can prevent VAPs. VAP is a serious complication and a healthcare concern that can prolong hospital stays, increase the risk of other complications, and unfortunately, in some cases, can be fatal. Treating VAP can also be challenging because the bacteria causing the infection may be resistant to certain antibiotics. This makes prevention even more crucial. Preventing VAP is a team effort. Doctors, nurses, respiratory therapists, and other members of the healthcare team must work together to implement these strategies consistently. Consistent adherence to established protocols, constant monitoring of patients, and open communication are all vital for effective VAP prevention. In conclusion, ventilator-associated pneumonia is a serious complication, but with diligent prevention strategies, we can significantly reduce its occurrence and improve patient outcomes. By understanding the risks and implementing preventative measures, we can help ensure the safety and well-being of patients relying on mechanical ventilation. And that concludes our discussion for today. This is part 4 of a 5-part series on healthcare-associated infections. If you haven't watched the first 3 videos, click above to watch the first video in the series. Subscribe to our channel to watch our videos and stay updated. Prepare for the 5th and final type of healthcare-associated infection, multi-drug-resistant organisms. We sincerely hope you enjoyed this video. Please feel free to leave any suggestions, requests, or questions in the comments section or send us a message. To learn more about Zaco, visit our website, zaco-sa.com, or email us at admin@zaco-sa.com. WhatsApp or call us to reach our experts for assistance in accreditation matters such as SPAHI, JCI, or GAHAR. Follow us on social media, and don't forget to subscribe to our channel. Thank you for joining us, and remember, stay informed, stay safe, and stay healthy. Zaco. The power of expert consultations in the palm of your hands.